Okay, so hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories all of our work takes place. My name is Autumn Sipus. I am the project manager for the Canadian Coalition for Green Healthcare, and on behalf of the coalition, I would like to welcome you to today's webinar, Building a Low Carbon Energy Toolbox for Your Healthcare Facility. This webinar is being delivered as part of the Coalition's Preparing Canada's Healthcare Buildings for Net Zero project, made possible with investment from the Government of Canada's Low Carbon Economy Implementation Readiness Fund. Throughout the event, please use the chat function for any technical issues you may be experiencing, use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of the event today. We will also be recording this presentation, and the recording will be sent to all registrants and will be available on our website and YouTube channel at a later time. So presenting today is Caitlin Points. Caitlin is the director of the project engineering and energy team at Unity Health Toronto. She is passionate about all aspects of sustainability, and in 2019 started the energy team at Unity Health Toronto, leading a team to establish and build an energy management program, winning the Save on Energy Energy Manager of the Year award in 2021. She is currently developing and building the sustainability strategy for Unity Health and developing the GHG emissions roadmap with a reduction target of 50% for scope 1 and 2 emissions, which is both challenging and rewarding work. All right, well, take it away, Caitlin. Thank you for being here.
Great. Okay. Well, thanks everyone for joining me on your Valentine's Friday. So I'm going to jump right into things. I'm going to start with this image. I love analogies and storytelling. So I wanted to share a little bit of how I would describe my journey throughout the process of starting, building an energy team, and still in the midst of everything, really. It's to me, it's like crossing a fog-covered lake. You know there is a shore on the other side somewhere, and you know there's some stepping stones to get there, but you can't quite see them all. But what you can see is maybe the first one or two stones in front of you. And so really that's the theme of my conversation and chat today with you is what you can see, take that first step. And as you start to move forward into the fog, the other stones will appear. So I would say even where I am now, I don't necessarily know what the full path looks like. So it's a learning experience, and I love learning and passionate about that sort of thing. So that's my story to start off. And as Autumn mentioned, I'm just going to be talking today a little bit about how to start building a low carbon or low emissions toolbox, and then how to apply filters to that toolbox to then take steps forward. So step one of building a toolbox is assembling a toolbox. So some of the things on this screen here, I've got technical solutions. So you want to start immersing yourself in all sorts of technology. It's not necessarily new concepts per se, but sometimes the way in which those concepts are being applied are new or potentially novel. This process of assembling and building a toolbox really is an ongoing process. It's not something that you just do once at the beginning and then forget about it. It's consistent and continual. In addition to the technical solutions, you also need to have an understanding of codes, regulations, standards. Specifically, as the industry continues to evolve, I'm finding learning more and more about what's currently in code versus what might be coming down the road in code and standards. So you want to start thinking a little bit forward thinking, not just thinking, what can I do today, but what might I be able to do tomorrow? And that's where learning about things is not necessarily you're not losing time doing that, because there's always going to be a reason that you need to come back to some of these concepts. Benchmarking and best practices as well are important things to consider as you are building your toolbox. I have some examples, but I will get into those a little bit later at a future slide. And in terms of some of the technical solutions I've listed there, those are just some of the ones that I've been learning about more recently myself. Heat recovery, again, not a new concept, but some of the ways in which it's being applied or used are changing. And adiabatic humidification is using water to humidify the air, which currently is not in the CSA standard, but language was included in the CSA standard most recently at the one that was released for a public review. So things are constantly shifting as time goes on. So in terms of some tricks and tips of how to continually build your toolbox, building a network I find is really important, similar to just what we're doing today, where you're getting to meet people, as well as some of the other low carbon hub networking sessions that are part of this program. Never underestimate talking to people who've implemented the solutions, learning from their lessons, and learning from things that they've done, and borrowing some of those practices. I've talked to lots of people, and I'm always learning something new when I do. It's important though, when you are talking to others and networking, that I do find that everyone's journey is a little bit unique. Although we're all healthcare organizations, that depending on where you're physically located, whether you're in Ontario or BC, or maybe a more northern climate or more southern climate, you do need to think about what are the constraints that particular organization might have had that you may not have, or vice versa. I had been talking to someone recently who had been doing some projects on their heating and cooling systems, and they had the luxury of lots of space in those places. So they had more flexibility in terms of installing new before decommissioning old, versus some of us that are a little bit more landlocked may not have those opportunities. So it doesn't mean that you still can't borrow concepts, but really thinking that, are these technologies applicable to me? And if they are not applicable to you, put them in the toolbox anyways, because I'm telling you that you'll never know when you might have one of those aha moments, where you come back and borrow things that you might have learned in the past, in the current day. Leveraging vendors, again, they have lots of great useful information. I like to do the two birds with one stone approach sometimes as well, where you can have a vendor come in, do a lunch and learn, so you can actually learn about their technology and the application of it, and at the same time invite others to participate in that. So it's a great dual purpose, in terms of educating as well as getting engagement from your teams and your organization. And in terms of getting published research or case studies, ask the manufacturers, where have you implemented this before? Do you have some information you can provide? And when you're trying to compare two different types of technology, ask the experts about what they would say, obviously taking that with a grain of salt, because they might be selling more of their version of why they think their version is better. And I think what I'll say on that too is going back to that unique situation and what's your organization specifics, because in some cases you might have two very comparable technologies, and it's just that one might work better in your particular scenario than another. Okay, so the next part of your building your toolbox is figuring out how to filter the toolbox. And in order to do this again comes down to that concept of unique versus generalized technology, is you really want to get to know your facilities. I cannot underestimate the value of saying that having data is really important, making data-driven decisions. And it doesn't mean that you have to have very specific data. I know a lot of people think, oh, well, we don't have all the sub-meters. We haven't, aren't able to invest in that type of technology. You really don't need to. Just start with your utility bills. That's the first step that we took. We got a baseline based on that. It helped us to understand which of our buildings use more energy than others, as well as understanding what types of facilities they are in terms of how they operate. So you can see the energy profile. So not just total consumption, but are we using more in certain months than others, more at certain times of day than others? And so being able to really drill down at a higher level even is fine, to start to narrow down on areas of potential opportunity. In terms of Class A or Class B customer, this is just referring to the type of electricity customer you are. And the reason why I've listed this here is it is important in terms of what certain technologies might be more beneficial to you in terms of energy savings. And this is really about getting to know, again, your consumption of your facilities and how you pay for your utility bills. So, if you are on district steam, for example, then you are paying a direct provider, and you might have a fixed rate that's been set in an energy as a services contract, versus if you're operating your own boiler plant, then there's maybe more flexibility there to change the rate or change how you purchase utilities. So things to think about that are important when you're thinking about implementing initiatives. As well as a Class A customer, what tends to be more important is your peak demands on those top 5 days of the year. So for initiatives that reduce your peak demand quite a bit, that can be multiple benefit to you rather than just a direct cost per kilowatt hour. And similarly, if you are adding to your peak electricity consumption, which some technologies or applications of different things are doing because you're electrifying, then that's not necessarily something that is going to benefit you in the total cost. So it is important to understand, because not all vendors will be able, the business cases they provide you might be for a straight consumption as a Class B customer, for example. And we've had that before, where something looks really beneficial, and then when we drill down into the details, it's less so. Heating and cooling loads. So this is getting into a little bit more specific. So one step further beyond your utility bills, but understanding your process loads versus your peak loads. And the reason why I've listed this specifically is, as you move forward with your decarbonization plan, you're going to learn, or at least you might learn, I've learned that you're trying to size things to a peak load can make things very expensive versus looking at hybrid solutions and how can we manage our process load versus our peak load and the size of equipment and the change to the capital cost that might incur. And also in terms of the hybrid solutions, I think it's important to understand too that then you get better resiliency as well as redundancy when you're using different methodologies to supply the load to your building. Domestic hot water heating and sterilization, especially when you're looking at heat recovery solutions. Hospitals generate heat around the clock every day, all year, even in the summer and winter times, both. So when you're looking at the heat recovery, the great thing about heat recovery is you're using wasted energy, but you need a place to put it. And so understanding what are your consistent domestic hot water loads calendar year around, as well as sterilization loads as well, and humidification. So those are just some potential sources. Supply temperatures and delta T's as well, understanding what are your current set points and what do they need to be. So an example here, we have a heat recovery chiller in one of our facilities, and some of the solutions that we had looked at as a demand flow response system for our chilled water wasn't going to be as beneficial for us because we had the heat recovery where we're actually trying to hit a higher temperature or different delta T temperatures across our equipment. And so it's important also to understand what are the delta T's, what are the supply temperatures you need to meet. In newer facilities, you might be able to drop your supply temperature on your radiant heating a little bit more if you have a very robust building envelope, versus in an older facility, you might not have the right technology at the terminal side of the system in order to support a change in temperature. As well as age of infrastructure, this also ties into the ability to upgrade your existing infrastructure. Just a really quick example as well, like, people will say, okay, let's install a VFD on a pump because that's going to save you energy. But if your pumps are really old, you actually need to upgrade your motor first before you can install the VFD. And now you're looking at, if my pump is really old, should I just replace the whole pump instead of putting a VFD on it? And the cost benefit analysis, and am I spending money that I'm going to then come and rip out later? Contract and service agreements. So there could be opportunities to leverage services through your contract and service agreements, or you might be, I don't want to say stuck, but you might be required to go with a certain type of equipment or manufacturer based on existing contract and service agreements. So really knowing what your constraints are there for your different systems and your services is another important factor. You might have a vendor coming to talk to you about a water treatment program, and if you already have an existing contract and service agreement with the water treatment vendor, then you might be taking time that is, you won't be able to make that switch. Doesn't mean you shouldn't put in your toolbox though, because you might say, okay, when we're ready to renew that contract, we're going to go to the toolbox and pick out that piece of technology that we learned about and wanted to implement. So the other part of filtering your toolbox, getting to know what people will buy, you don't want to sell something that if you show up, the door-to-door salesman trying to sell a pair of running shoes and someone's got a closet full of running shoes, it's not going to work. So what you need to think about is, what does the organization need? What are they interested in? Aligning with those priorities and values. You might be trying to solve a problem that others don't really think is a problem. So it's important to understand what it is you are going to be most successful in selling. And it may not be the best option out of, let's say you've identified 3 opportunities, and the best opportunity for energy savings is not something people are willing to buy. Well, then we might have to think about what's the next thing to do. And if you haven't already, I would highly recommend that you do sit down and have conversations about this. It just, hey, let me buy you a coffee, director, VP, exec. What are the things that are in your mind that you see as important? Like, really get to know the people that you're working with and the organization that you're working with in order to know what to bring forward and when to bring it forward. If it's not a good time, we just implemented a very large electronic patient record project where that was the priority of everyone's day, of everyone's focus, also financially as well. And so that might not be the right time to sell something. So getting to know what people will buy and when is best to sell it. Understanding complexities and interdependencies. I'm sorry, I didn't switch my slide. So I did talk about a lot of these things on my previous slide in terms of filtering the toolbox, but in terms of the existing infrastructure and what sorts of temperatures you're able to supply, as well as the building envelope. In some cases, you might have to look at building envelope in order to enable you to implement certain things, as well as obsolescence of technology. In terms of order of operations, reducing your loads first. So if you're going to replace a chiller, if you're able to reduce the consumption load, then you could replace it with a smaller chiller. Or if you add a heat recovery component to that, maybe you can reduce with a smaller chiller. And similarly, this comes back to knowing your process loads versus your peak loads and how you can use a collection of different equipment to meet those loads. Smoothing your demand profile. Again, if you don't have a huge peak, then you don't have to size to the peak. So something else that you can consider, as well as the building envelope renewal, which is really hard, I know, to calculate what the payback would be without doing some sort of model, which is a bit of a pie in the sky situation. I myself haven't really gotten past that hurdle yet in terms of trying to build the business case for retrofitting your building envelope. But if you do some of these things in advance of just replacing the equipment, then it can help reduce your capital costs. And sometimes this, I'll mention as well, seems perhaps a little bit counterintuitive that you would start with your newer buildings versus your older buildings. And the reason I say that is because in some cases, your new buildings might have the new technology or the new infrastructure that's installed, and it's easy to enable some of these newer solutions. It might be implementation ready, so to speak, but maybe the switch hasn't been flicked on that. Like, a lot of the times, new buildings might be installed with new software modules for lighting controls, but they haven't actually been scheduled and turned on properly, or maximizing the use of that. So potentially recommissioning or commissioning or turning the switch on some of that newer technology in your newer facilities might get you that savings that you need to build a business case to then use that and repurpose it back into your existing facilities. There are a lot of complexities with existing facilities, I find, in terms of implementing things. So understanding the technology specifics, another important tip that I'll give you, thinking about that big picture versus just a fragmented piece. So one example that I can give is, for example, a battery storage solution. So this is the cost savings versus consumption reduction, right? So a battery savings, if you're not using it to actually supply electricity to your building, but it's the solution where you have a charged battery and then it comes on during the peak day for your Class A global adjustment, then that's really giving you a cost savings, which could be what you're looking to get, but it's not going to reduce your consumption other than for the period of time that it's on, which is about 5 hours a year. So thinking about, again, this goes back to your organizational priorities and what is it that you're trying to accomplish. So there are solutions out there that are addressing on the cost savings, not necessarily consumption reduction. And similarly on the emissions versus consumption, if you go with a fuel switching situation, then you are reducing your emissions, but you're not necessarily reducing your consumption. So being conscious of the difference between the two of those things and what it is you're actually trying to achieve. And if you're going to do fuel switching, again, that comes back to that order of operations. Should you be reducing your consumption first before you look at a fuel switching situation? Additional success criteria, never underestimate people behavior. So a lot of optimization solutions require people involvement to, whether it's something that's causing alarms on your BAS, then someone needs to look at it, or they're giving you suggestions on how to run your equipment, then through some sort of software optimization. Again, that requires a change in process there. So that can be not necessarily a barrier, but it can definitely be a challenge to implementing things. Do you have the right internal resources and support? So identifying whether or not you have the internal expertise to PM that project, or to follow a solution implementation along, or do you need someone external to help you with that? Maintenance requirements, you don't want to overlook the total cost of ownership of something in terms of its, I guess, cradle to grave type of life cycle. Maintenance is one of those things, but also disposal. And if there is proprietary technology, does that mean that you yourself can't access or maintain it without bringing in a technician or flying a technician from a certain country to your hospital? And M&V, I would just caution that as much as we all love to measure and verify things, you need to think consciously about whether or not that particular project requires your detailed M&V, or what type of M&V does it require. If you're installing LED lights, for example, on more simple case, you're not going to meter every light or meter the electricity for the new lights. You can just be fairly certain that a calculation on the wattage consumption differential is going to suffice, versus something more complex. Maybe you do want that M&V, and maybe you want an M&V over what period of time, so you can ensure that what you have implemented is sticking and staying. Let's just checking my notes here. I've just made another note here as well, that centralized versus decentralized heating and cooling. So, heat pumps versus a heating and cooling plant. We have one specific clinic building that's run off of heat pumps, and it's the most efficient building that we have. But that being said, you have several heat pumps that you need to go around and maintain versus one centralized heating and cooling plant. So those are some other things to think about. So in terms of aligning and integrating, I mentioned this a little bit earlier on as well, selling the project. I've got a little piggyback photo there because that's the concept I like to use, is figuring out, again, what is on the table at your organization, what's being scheduled, what infrastructure renewal is already planned or you foresee will need to happen going forward, and how can you piggyback on those projects that are going to need to take place. Unfortunately, in our facility, we've had some infrastructure that's aged and needs to be replaced, and we just haven't had enough runway to really figure out how we replace it with a low carbon, low emissions solution. We've had that happen on our boiler side of things, and we didn't have enough time to sort out what we wanted to do. I mean, the new equipment will be more efficient, yes, but in my perfect world, we would have been looking at a decarbonization solution instead of a like for like replacement. So thinking about what those capital funding plans are and how you can leverage money that may already need to be allocated to retrofits or replacements, and leverage that. But a lot of these solutions I do find take quite a bit of time and to think about and plan. So you want to think a couple years ahead on that, if not more than that. Using co-benefits as a primary way to sell a project. So decarbonization is a piece of it, and it really should be a piece of every project that we do. So coming forward with just a project that we're calling decarbonization versus if you call it infrastructure renewal with a decarbonization component or a low carbon, low energy component, then that is something that is more likely to be bought if you're selling that. Staff satisfaction and retention, that's another co-benefit that can come along. Aging infrastructure, which I mentioned already. Operational challenges. So if you have an existing operational challenge, then I'm just thinking of some that we've had at our site in terms of, maybe the heat exchanger doesn't seem to be working quite right. So that might be the perfect opportunity. We have to have someone come in and clean the heat exchanger. We might as well have them do assessments on the other heat exchangers while they are here. So tag teaming or piggybacking on tasks that are already planned as part of maintenance, as part of capital funding plans. Other great co-benefits from decarbonizing is you're adding redundancy a lot of the time to your site, as well as resilience for climate change. Integration options, so making use of what you have, capital projects, low to no capital solutions, could be sequence of operations. There's a lot of opportunity, I find, typically speaking, with sequence of operations, especially if you're looking across seasons, because often, unless the equipment is running off of an optimization solution of its own, and even then, is it taking the right data in? If it's an AI type system, it's only going to learn based on the information you've given it. So if you haven't given it data points, and as we're seeing weather events and things come that aren't really part of our past experiences, maybe the predictive maintenance piece or the predictive sequence of operations isn't going to work the way that you might think it will. And leveraging redevelopment. So thinking about how we can use, if you are planning a redevelopment of your site and taking down an old facility and building a new one, or just building a new one in general, are there ways to integrate the new infrastructure of that redevelopment into your existing infrastructure, or building more capacity to eventually retrofit your existing and have it feed off of a central plant, if that seems like it could be something that would be beneficial. The other thing I will say is finding champions and engage them. So thinking about the people potential side of things. I find that people inherently want to do good, and it's just sometimes they're not given the opportunity or the permission to do that. So finding the people that are passionate and bringing them on board and engaging. I've had to do this several times myself because I'm only one person, and even our team is a select group of individuals. And so reaching out to our sister departments with the facilities redevelopment planning teams and saying, hey, I have this idea. Is anyone interested in this and willing to help move it along? And it doesn't mean that it's happening quickly, but at least there are those little steps that are being taken every day. And you can hold one another accountable. It's good when I find champions, they follow up with me and I go, oh yeah, right. I knew I was working on something that I forgot I was working on. So the last thing that I'll say is, don't get discouraged. We have had business cases that we've been working on that have not been implemented. And I would say sometimes that's been the one of the best lessons, actually, because especially with when we started the energy team, we had done the LED lights, the VFDs, the 2 to 3 year payback type projects, and now we're moving into these larger, more dynamic, more holistic thinking, big picture thinking type of solutions. And with that comes complexity of how they will be implemented and the delivery methodology of those projects. And so as we're developing some of those business cases where they really are 10+ year payback situations, we start looking at the total cost of ownership, the cost of maintenance, the risks around a 10-year payback or longer. What happens if the carbon tax goes away, or what happens if electricity price skyrockets, and just thinking about the different scenarios and how that might apply. And through going through that process and those use case scenarios, I learned what was important to the organization and what were the go, no go criteria. So for our organization, we weren't interested in any sort of operational budget increase. So then it was like, okay, well, that's a new border I need to work within, right? And thinking about that. And just as you even go through the process of trying to think, okay, these are the steps of the project, you come up with things in terms of, okay, what is the project delivery methodology? Are we open to an ESCO? Are we open to a long-term 30-year contract? Is that something that we're interested in? Would we entertain that as an organization? And so you start to figure out what is important, and the must-haves, the need-to-haves, or the nice-to-haves, and how all of that works together. So it really is a process and a learning one at that. Funding sources as well. You know, if this is a $5 million project, how would we fund it? If this is a $30 million project, how would we fund it? If this is a $100,000, how would it get funded? And so understanding, it helps you to better navigate then how you're going to move through with implementing a project. So that's the process of developing the business case being a useful exercise. What are the deal breakers? What's results in a positive business case? And it prepares you for next time and helps you select projects with a higher likelihood of moving forward. And thinking about the end-to-end life cycle is not just finding the technology, but procuring the technology, the construction and the implementation of that technology, and then the post part of that as well, and what type of contract you're using. So many things. So there's so many different things, and every time I do a business case, I learn something new. So my last slide for today, just talking about, remember that, you know, learning in action, it's an ongoing process. You don't need to know the full path to take a step. If someone was to ask me now, actually someone asked me this the other day, like, do you have a clear vision now of where you're going? I'm like, no, not really, because everything is changing day after day. And I think that this is a very dynamic landscape in terms of energy savings, emissions, decarbonizing, sustainability in general. I'm still learning every day. But what I do know is what I can see in front of me. I'm working on the step that I'm working on right now. And as you take those steps, further steps will begin to become clear. You know, just learn, adjust, evolve as you go. And remember, perfection is paralysis. So you cannot wait for something to be perfect before you try. You have to try. And as you try, you will learn, and then you can adjust. So it's an ongoing process. I think that is my last slide. There we go. So happy, yeah, teach me something I don't know. I'd love learning things, and happy to take any comments, questions, or feedback.
Yeah, so it looks like we got quite a few questions here for you, Caitlin, and a couple hands up. I think I'll start with the Q&A, and then we can move to those with their hands up. So start with Carla. She said, you had mentioned gathering data for both process loads and peak loads. What is the benefit gathering data for both and comparing them as opposed to just looking at the peak load?
Okay. So your process loads, although there can be inefficiencies in your process loads. So I'll use the example like sterilization, for example. That's something that's happening year round. So you know that that's going to be something you can't necessarily get rid of. There might be inefficiencies in that bucket, but knowing what that is important to understand. Domestic hot water, again, is a process load. It's something that gets used year round. Knowing what that amount is gives you an understanding of if you were to do a heat recovery solution, for example, what how much you could recover. So like as an example, let's say you're going to install a heat recovery chiller and it's going to produce a certain amount of heat in tons, but you don't have that much of a domestic hot water load. Then you're essentially purchasing a piece of equipment that's going to provide more heat than you need, and you're going to end up rejecting that heat somewhere else. So understanding what those buckets of your loads are so that you can properly align your heat recovery solutions with those levels. And then Autumn, did that answer the question? What was the other part about peak load? Sorry, Autumn, sorry, you're muted.
Thank you. I think you pretty much answered it. The question was, what is the benefit of gathering data for both and comparing them as opposed to just looking at the peak load?
Right. And then I guess the only other thing I'll mention on that is that so you might decide to, because in theory, electrifying is, depending again on what type of electricity customer you are, could be more expensive. So if you try to electrify to hit your peak load, you're going to end up having a much larger piece of equipment and spending a lot more versus just saying, I'm going to have a hybrid of one electric boiler and one gas boiler, for example. And the electric boiler is going to manage all the process loads majority of the time. And then that 20% of the time when we need to hit a peak, then the gas boiler will come on.
Great. Thank you, Caitlin. Okay, next question was from Lori. Do you have data comparing older systems to newer systems?
If you mean like between like each facilities, because each of our buildings are different vintage and different age, then the short answer would be yes, we do have that. And I can tell you that sometimes the newer systems aren't always more efficient than some of the older things that we have. Now, whether or not that's because we don't have some areas of our much older facilities don't have the same levels of ventilation, for example, as our newer facilities. There are reasons why that might be. Or as I mentioned before, sometimes those newer systems just haven't been fully commissioned to their full potential as well. So there might be opportunity, as per design, they should be more efficient, but whether or not it's actually operating as such is another thing. So we do have data across all of our buildings, and it is interesting to compare the different buildings with one another.
I'm sure it is. Yeah.
Yeah.
Okay, I think I might let one of our hand up people speak. David, if you're ready, I'm going to allow you to talk now. It's always a hit or miss with these. Did we accidentally put our hands up? We never know. Maybe we'll let Miles, I see your hand up. We'll let Miles go as well. Miles. I think you guys can mute yourselves if you're ready to ask your questions. Let me know if you have any issues. Okay, well, we figured that out. There's a question from Douglas who said, if you retrofit, there is the carbon footprint of creating the new materials and the waste of the old materials. How do you find the sweet spot that makes this beneficial?
So yeah, and that's referring to more on the, I guess, embodied carbon argument and the total emissions, like scope 3 and everything that's included. And I think that just comes back to aligning it with already planned infrastructure renewal where possible. And I think the other example I gave was, if you're installing a VFD on an old pump, is that the best use of that new infrastructure? Or, I mean, in some cases, if the VFDs are able to be reinstalled on a separate pump later, then you're not necessarily wasting that money. As well as a VFD is an add-on, so it's something new. You're not necessarily ripping something out, you're adding something to an existing piece of infrastructure at that point. But if you wanted to, say, replace an old pump with a new pump, then thinking about not ripping out your new infrastructure just to replace it with something new again. And I think I'd also mentioned that in some cases, looking to if your goal is to decarbonize and reduce emissions and reduce consumption, sometimes making use and leveraging your newer infrastructure, which seems, I know, counterintuitive, but is the better way to go on that front, because then you're not necessarily having to replace infrastructure in order to get those energy savings, especially on the sequence of operations. We had looked at doing setbacks in our ORs, for example, but because it was older infrastructure, we didn't necessarily have all of the right types of controllers like CAV versus VAV at the terminal side, as well as the right monitors and the CSA requirements to have a button to revert the system back, and like all these layers that you're basically having to add. And then looking at the other thing that always comes up is, okay, well, is this space going to continue to serve this exact same purpose for how many years going forward? Because most of your redevelopment teams are going to have a master space planning um, uh, plan. And in that case, if the lab is moving tomorrow, you don't necessarily want to retrofit all of your fume hoods and then have it all get ripped out the next day. So it really becomes a bit more of a moving target, and trying to find all the synergies between your capital infrastructure plan, with your master space redevelopment plan, with your decarbonization plan.
So thanks, Caitlin. Miles, do you want to go ahead? See, you're unmuted.
I'm surprised Miles doesn't want to say anything.
Sorry, am I unmuted?
There you go. We can hear you now.
Caitlin, I'm sorry. I'm just a mess right now, okay? I just went out to get some lunch and I put my hand up. Great presentation. How's that?
Thank you.
I'm gonna go back on mute and lower my hand. Thank you, everybody.
Okay.
Okay, that's it. That's it. That's all I've got.
Really? No grilling for Miles? Okay.
David, if you're still around and can unmute, you can go ahead now. See what I said? It's always, you never know if the hand's up by mistake or, but we always appreciate the comments and the questions. Okay, I also have David here that has his hand up. And
okay, you unmuted me. Can you hear me now?
We
Sorry.
can hear you. Yeah.
Okay. Other than the other David who also. Okay, great presentation, Catlin. I just returned from AHR Expo in Orlando and attended the ASHRAE on a new standard for infection control, 241, which we're now helping bring back to Canada. So I was wondering if, because their point was, after COVID, people just overventilated. You know, we were bringing in fresh air to meet the band. So I just wanted to know if the health systems have heard about that, and I'm happy to share what I learned down there, because there's wasted energy, as you can well imagine, if you got clean air, but you're doing it at twice the CFM than you need.
Yeah, I mean, this is only my personal opinion, is I agree that there wasn't really any evidence based around going to 100% outdoor air that would be better than running our regular process and then through filtration. So, and I don't know if I actually know what is the better solution, or whether what I have learned, I guess, in terms of airflow, is what tends to be more important is how the air moves through the room. Is it being pushed onto the patient and then pulled out at a low level return or a high level return? So it's really more about the air circulation within the room itself that tends to impact where the contaminants are going and who's breathing them in first and whatnot. So
yeah, I agree. I think they were really focusing on retail, schools, and office buildings that weren't health, that didn't have HEPAs, and were measuring it to the nth degree, because that may be the market. The other question I put in, and this relates to your comment about the building envelope, which I've studied for over 30 years, I guess. It's true that initially windows didn't pay, but that was because people thought they had to replace the window. I just helped a company put in insulation on the existing windows, not for the $18 a day from Toronto Hydro or whatever. The people sitting next to the window were literally sitting there with electric heaters. I just saw the question or the comment made. So it's about the non-energy benefits as well. And I've seen a company that's putting glass on exterior windows in Boston, New York because of the cost. So I think there are opportunities. We got to do the building envelope before we start putting in heat pumps. Even though somebody says, well, you can buy a bigger heat pump, but you're running it on whatever it is, that electricity that we're in such demand for the next 30 years. So I do.
Yeah, and I think the challenge when you start buying bigger equipment, then when it comes to replace it, you're like, oh, we better put something bigger than that in now, because you always tend to upsize as you go. Like, oh, we better add some extra capacity if it's already this, so it kind of, I feel like it can spiral out of control. And you're right about the space heaters, and that's part of really, that's about getting to know your building, and actually walking around and seeing what are people doing, because at the end of the day, even if you try to do a temperature reset, but there's temperature control in each room and you're resetting back at the unit, then your reheats are all going to come on in the room. So you really
I'll
need to.
I'll just add. Uh, I was studying view where we could, dim the windows like our sunglasses. I think Sunnybrook or somebody tried it. It's about the patients being able to have natural light and get better.
Mhm.
But the end, when the sun came around, the view glass would, lower the solar heat gain coefficient, and the chillers would work less. Anyway, thanks. Great presentation, and hopefully we're continue to decarbonize.
Thanks, David. Okay, we had a question in the chat from Ron. So he said, in terms of envelope renewal, goes in line with the conversation, whenever we have raised for our 50, 60, and 100-year-old buildings, what continues to come back as a block is the over-occupancy of patient wards and the necessity to pull back rooms on the exterior due to IPAC concerns. Have you seen this or come across innovative solutions for buildings that are over-occupied?
I'm not sure if I understand the pullback patients from the exterior. I'm not sure if I fully understand what it's saying.
Yeah, I'll read it again.
I think I saw it in the chat.
Oh yeah, go take a look. It's a
It
long.
says what continues to come back as a block is the over occupancy of patient wards and the necessity to pull back rooms. I'm not sure I'm not familiar with what the IPAC concerns would be with patients having rooms, unless you're saying the temperatures are not appropriate.
Had added an additional comment here to the end, just said we need to vacate the spaces to allow for construction.
Oh. I see. Oh, a block is the okay, I'm understanding what you're saying. Yeah, I don't know if I have enough knowledge on the different types of building envelope retrofits, because I know that like one of our buildings we did, like David was saying, we didn't replace the windows, we actually just redid the not the insulation, the sealants, the window sealants, and we were able to do that work from the exterior. So and I don't know if all the building inserts themselves are always done from outside or inside. So I think it might depend on the technology. But yeah, I mean, absolutely getting access to any sort of patient room is a challenge at best. And so I think it would just get down to the specifics around what the scope of work is in terms of what tools you need to use, what sort of dust generation is happening, and if you're able to, and how long it's going to take. Not that we like moving patients into hallways, but sometimes if it's an inpatient unit and the patients are going out of their room for a period of time to get tests done, and we don't need to hoard the whole room per se, but hoard the area that's being worked, can you do the work while they go out for their CT scan and try to coordinate that way. But again, sometimes that's not always possible. Generally, when we do work in patient rooms, we just have to come up with some sort of decanting plan. I guess if you had spaces elsewhere in the hospital that could be repurposed to patient rooms for a short period of time, that could be an option. But yeah, it's very challenging.
Thanks, Caitlin. So we have one more question in the Q&A from Lily. Can you share some examples of projects or initiatives your team has worked on in collaboration with clinicians? I'm particularly interested in understanding how clinical insights have shaped the outcomes.
Yeah, So, I mean, I do have examples, maybe less on the energy specific side. I mean, there's lots of times when we actually also have patient family partners sitting on our advisor, like our sustainability committee as well, to get perspectives from the patient side of things. On the clinical side, like right now, one of the big projects that we're currently working on is nitrous oxide removal. And so I think my PM is the only non-clinical person on that initiative, and we've got RT on there, as well as facilities from the maintenance of the bulk tanks, but anesthesiologists and are a big part of that initiative as well, obviously, because it influences their clinical practice. We also have actually we have a sustainability, it's going a bit off topic, but we have an award for sustainability spotlight award that we have for each of our sites. And so and it's a yearly thing, and the last three winners of that have all been clinical teams. So these are sort of those sustainability champions I was talking about. We had the compassionate equipment recycling program where in our one building where palliative care takes place, when they can choose to leave the equipment, and then to get our clinical engineering team to fix it up and get it ready to go, and then we donate it to someone in need, another patient in need. So there are lots of initiatives on the clinical side and to be fair, 80+% of our emissions as a healthcare organization is due to medical supplies, clinical work, all that supply chain associated with that work. So that really is the place where we can make a very large impact. So it's really important to engage with the clinical teams. And I think that's something that we could be doing even better. But part of it is also just trying to find that time and permission for those teams to be able to work on some of those initiatives. So I don't know if that answers your question, Lily, but choosing wisely, I mean, that's a whole nother, reducing the amount of procedures that we're doing or tests that we're ordering is another big one. I could go on. I have lots of examples.
So thanks, Caitlin. Yeah, I think if we truly want to decarbonize, reach net zero, it's all the departments, all these leads working together to reach it, because it's not just scope 1 and 2, it's that scope 3, like you said, with the supply chain, pharmaceuticals. It's a huge amount of emissions, and we all need to be working towards that goal. So awesome. Well, I think that is everything. Thank you so much, Caitlin. I do have a survey, a post-webinar survey, that I would appreciate if everybody took the time to participate in that. My assistant, Luce, just put it in the chat. I will also send that out again along with the webinar recording and presentation slides. Those are going to be sent to all of the registrants either later today or early next week. If you have any additional questions or want to get in touch with Caitlin about anything, I'll put my email in the chat, and happy to connect with any of you. So yeah, thank you again, Caitlin, and thank you everyone for joining us today.